Hello everyone, I'm Dr. Satpal Singh Shekhawat. I'm a GP in Curtin, Lindsey and Scott Surgery, and I'm also Medical Director for North Lincolnshire CCG. I'm going to talk about what we've been doing for the last couple of months with a bit of technology, and that's helped our patients who suffer with COPD. So I met for Dr. Farhan Amin, who is a GP in Barrow-in-Furness, who had started this program with his own patients, and he was providing pulmonary rehab via virtual reality. I found it very interesting, and I started to look at how we could roll it out for our patients in North Lincolnshire. North Lincolnshire is a rural place, and it's very spread out over 325 square miles with poor public transport. So there was a need for delivering this kind of service where patients don't have to rely on public transport or their relatives to travel to classes where they would benefit from pulmonary rehab. We worked with NHS England, and I'm very grateful that they supported this project, as this was in line with the long-term 10-year plan of providing patient care nearest to their doorstep. So in this program, we provide patients with kits, which are virtual reality headsets, so something like this, which can be worn over their eyes, and the program is supported with a wrist pulse oximeter, so a device which is something like this, which provides us with information on their heart rate and oxygen levels. These are all connected with telemedicine, so the office where our team is based can check on how the patient's progressing along the program. They can also monitor oxygen levels and pulse rate. And in some cases, we can pick up early signs of deterioration if patients getting unwell or getting an exacerbation. The feedback from patients has been really, really good. They have been very pleased with the program, and they were quite surprised at how easy it was to embrace the technology. In terms of certain patients where there is no access to internet or Wi-Fi, we also provide them with a MiFi device which allows them to connect, and once they have finished the program, which is a 6-week program, we take back the kit, we clean it with infection control guidelines, and then we pass it on to the next patient. Now, in terms of the benefits of this program, it's not only helping our patients exercise capacity and helping them to do an exercise program which is improving their quality of life, it is also giving them flexibility, so they can do this exercise at any time they want, from their own household, from their own living room, and that's been very encouraging because it's allowing them to engage better with this program. In current scenario where we are all struggling with the lockdown issues from COVID, we all know that the traditional standard pulmonary rehab programs have to be stopped or suspended because of the worry about spreading this infection to our patients. So in this scenario, this technology, this virtual reality pulmonary rehab has been a real success. And that's why I wanted to share this with all of you. And I'm very happy if you want to contact us for further information. Now, in the second half of the video, you will be seeing what I would be casting from our headset onto a television set, so you'll be able to see what the patient sees and how the patient navigates through this program. So as you can see, this is the casting from the virtual reality headset. It's got a beautiful setting there, so you can see the nice little beach. So when the patient's got the headset on, this is the home page they'll get to, and they can choose any of these modules. So there's a lot of educational modules built in, and then how to manage their COPD. Now for this, as we scroll down, I'm going to choose the active PR module, and all they have to do is point that the program loads.
Welcome to the strenuous exercise module. If you've reached this level, it means you've made excellent progress. You may get out of breath during this phase because some of the exercises are quite tiring. If that happens, just pause and do the rescue breathing I taught you before.
So this is how the program looks to them. So there are two people there sat in front. You can see the heart rate and saturation on the top, and this is the view of the beach where they're going to do their rehab, and this is the view of the swimming pool next to it. So a lot of positive feedback from patients on that they really enjoyed having these two people sat next to them, because it looks like they are doing the exercise with them. Now I'm just going to unmute this so you can hear the narration from the instructor.
May ache for up to 48 hours after the strenuous exercises, but new joint pains or worsening pains are not okay. If you experience those, scale down your effort in future. Our first warm-up exercise should be familiar to you by now. It's the grape treading we did in the other sessions as well. Let's do 30 seconds of that. Make sure you push down quite firmly into the ground. Push, 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 and keep going until the 30 seconds are up.
So once, as you can see that empty battery on the side, as they complete their modules, that battery starts to fill up, which is designed to incentivize them to keep active with the program. Once they've had enough and they want to return, all they need to do is point to the return button and they'll get back. And as you can see, we're back to the home page, and whenever they're logged in, we can monitor the exercise program and the progress they're doing. So it's a very relaxing sort of setting to do exercises, and obviously in this current time they can do it from their home. And it's quite relaxing to listening to those waves. So thank you for watching.